In today's clinical case, we are managing a severely inflamed epidermoid cyst that turned into a painful abscess. Learn how we safely and painlessly drain this infection step by step, including the complete 15 days recovery process. So now let's begin. Welcome back to Healfit Media. Today we are tackling a very severe and painful case on the upper back. This hardworking patient who runs a local street fast food stall has actually had this lump for about 15 years. Over the years, he would occasionally have his wife squeeze it to empty the contents, and it would temporarily shrink, but only to grow right back. But recently, he tried to poke it at home with an unsterile object. That single mistake turned a quiet cyst into a massive, raging abscess. And after that, the pain became so unbearable that he could not even sleep on his back, which finally brought him to my clinic. So what exactly was this originally? Actually, it started as a simple epidermoid cyst. And this happens when a surface skin cells move deeper into the skin and multiply, and that creating a little sac filled with keratin. And keratin is a protein that looks like a thick, cheesy paste. As we can see from its story, microtrauma like squeezing or poking with unsterile tools is exactly how a quiet cyst becomes infected. And that's why the cyst wall, that means sac, ruptures internally. And after that, bacteria invade the space and the immune system rushes in to fight it off. And that's creating all this trapped pus and intense inflammation. Right now, I'm truly sterilizing the area with povidone iodine, because this inflamed tissue is incredibly sensitive. That's why I'm administering the local anesthesia very carefully and slowly, so our patient does not feel any sharp pain during the drainage. Now the area is fully numb, so I'm making a small controlled incision, and there it goes. The pressure was immense. Now the definitive treatment for an uninfected cyst is total surgical excision. That means moving it whole. But when it becomes an infected abscess like this, the protocol changes. We cannot cut it out cleanly. So first we must perform an incision and drainage, or I&D, to clear out the active infection, pus and liquefied keratin. Now I am applying gentle, steady pressure to evacuate the cavity without damaging the surrounding tissue. I hope you noticed that I paused the video somewhere, because this is a crucial tracing moment. Look at these grayish fragments coming out with the pus. Because the cyst got severely infected, the intense inflammation caused tissue necrosis, meaning the cyst sac literally tore itself apart inside. These torn pieces are the necrotic cyst wall, that means the cyst sac. Even though we cannot do a clean excision today, I still have manually extracted all these fragments. If any piece of the sac is left behind, the cyst is almost guaranteed to recur. After that, once the bulk of the pus and sac fragments are removed, I am aggressively washing the inside of the cavity with a mixture of normal saline and betadine. Actually, this step is non-negotiable. It flushes out the microscopic debris and lingering bacteria hiding in the deep tissue pockets. That's why it's giving the body a clean slate to start healing. Now you might be wondering why I am not stitching this up. Actually, if I suture an infected cavity closed, the bacteria will get trapped, fluid will reaccumulate, and the abscess will just explode again. Instead, I am packing the cavity with sterile gauze soaked in betadine. Actually, this keeps the wound edge open, and that allowing it to drain and heal naturally from the bottom up. And it's a process we call healing by secondary intention. After that, I placed a clean bandage, and when the patient returned 24 hours later, I removed the packing and redressed it. Let his 15 years journey be a lesson. Never try to squeeze or pop a cyst at home with unsterile objects. If you notice a painless lump, have a professional evaluate it early. As you can see at the 15-day mark, it healed very beautifully, and our patient is finally pain-free and back to work. Thank you for joining me on this case, and I will see you in the next one on Healfit Media.